A man lies on the ground. His skull is cracked open. He is still breathing. Around him, a group of people kneel in silence. One of them holds a sharpened stone. Not to kill him, to save him. This is not a murder scene. This is 10,000 years ago. And what happens next will echo all the way into your last visit to a hospital. The man's head hurts. Something inside it feels wrong. Maybe he had seizures. Maybe he fell and never woke up the same. His people don't know about brain swelling. They don't know about blood pressure. But they know one thing. Something is trapped inside his skull, and it needs to come out. So they cut a hole in his head while he is alive. This practice has a name today, trepanation, and it is one of the oldest surgeries ever performed by human hands. Archaeologists have found trepaned skulls on nearly every continent, in France, in Peru, in China, in the mountains of North Africa. Different cultures, separated by oceans, with no contact with each other, all arriving at the same strange idea. Cut a hole in the skull. See if the person survives. Here is the strange part. It worked. Often enough that people kept doing it. For decades, archaeologists assumed trepanation was pure superstition, a way to let out evil spirits. Nothing more than magical thinking carved into bone. Some early researchers even dismissed the skulls entirely, assuming the holes were battle wounds or damage that happened long after death. Then they looked closer at the spells. Many of them show smooth, healed edges around the hole. That means one thing. The patient survived. Not for a few days, for years. Some skulls show 2, even 3 separate trepanation scars, each fully healed, each performed at a different point in the person's life. Somebody who did not understand anatomy, who had no concept of germs, who had never heard the word brain surgery, was operating on living human skulls. And people kept surviving it. Think about what that survival rate actually required. No anesthesia beyond whatever plants they had discovered, no sterile tools, no understanding of infection. And yet, in some ancient burial sites, researchers estimate survival rates as high as 50, 60, even 70%, higher in some cases than battlefield amputations performed thousands of years later with steel tools and trained surgeons. That should not be possible, unless something in the ritual was actually working. Here's what most people miss about ancient healers. They were not guessing blindly. They were watching closely for thousands of years. They noticed that some wounds healed clean and some rotted. They noticed that some plants stopped bleeding and some made it worse. They noticed that the people who performed the surgery a certain way lived and the people who did it differently died. That is not magic. That is observation, repeated generation after generation until it hardened into ritual. And ritual is a strange kind of memory. Long before anyone could write anything down, a ritual was how a community stored what worked. There was no textbook, no apprenticeship program, no written case study to pass down. There was only repetition and the fear of getting it wrong. Every step had to be followed exactly. The same tools, the same order, the same words spoken at the same moment. To us, that looks like superstition. To them, it was quality control. Change one variable and the outcome might change too. A healer who deviated from the ritual and lost a patient would be remembered. The community would notice. And the next healer would be warned. Don't do it that way. Do it the way it has always been done. Over centuries, that pressure quietly filtered out the methods that didn't work and preserved the ones that did. Because a ritual doesn't ask you to understand why something works. It only asks you to repeat what worked last time. And that is, accidentally, the first form of medical procedure on Earth. Somewhere in these healing rituals, a boundary starts to blur, between prayer and practice, between spirit and science. Look at ancient Egypt. Their physicians recited spells over wounds. They also cleaned those wounds with honey, which we now know kills bacteria. They also splinted broken bones with wooden supports, almost identical to a modern cast. 2 systems running side by side, one asking the gods for help, one quietly getting the technique right. The Ebers Papyrus, one of the oldest medical documents in existence, lists over 700 remedies. Alongside the magical incantations, it also describes real diagnoses, real symptoms, and real treatments that still make sense today. One entry describes treating an infection with moldy bread pressed against the wound. Centuries before anyone would isolate penicillin from mold in a laboratory, Egyptian healers had already stumbled onto the same principle through nothing but trial, memory, and ritual repetition. Ancient healers didn't separate ritual from remedy. We do that separation now, looking backward. To them, it was one single act: heal the body, please the spirit, follow the steps exactly as they were taught. And slowly, without anyone declaring it, the steps that worked started to get written down, taught, refined. That is the moment ritual becomes something else: a system, a practice, a profession. By the time you reach ancient Greece, something has shifted. A physician named Hippocrates starts asking his students to record every case. What symptoms came first? What treatment was used? What happened afterward? For the first time, healing is not just repeating what was handed down. It's being tested, tracked, and compared. That habit, more than any single medicine, is the true birth of what we now call science. Hippocrates also did something that seems small but changed everything. He insisted that disease came from natural causes, not from angry gods, not from a curse, not from punishment. That single shift, treating illness as something explainable rather than something mystical, is the exact moment ritual starts turning into medicine as we know it. But look closely at the structure that survived the shift. It still carries the bones of ritual: a trained specialist, a set of exact procedures, special tools reserved only for this purpose, even a kind of uniform. We just stopped calling it ritual. We started calling it practice. Walk into a hospital today and watch what happens before surgery. The surgeon scrubs their hands in a precise sequence, the same steps every single time. They put on a sterile gown in a specific order. They lay out instruments in an exact arrangement on the tray. Nobody skips a step even when they're in a hurry, even when it seems unnecessary in the moment. Ask a surgeon why they follow the exact sequence, down to the smallest detail, and they'll tell you it's about safety. But it is also something older than that. It is a procedure passed down, followed precisely, because deviation has cost lives before. That's not just medicine, that's ritual, wearing a white coat. The operating room itself follows an almost sacred geometry, a designated space entered only by those who have gone through the correct preparation. Instruments arranged in a fixed order, so specific that a nurse can hand a surgeon the right tool without either of them looking down. Nobody questions why the process is this exact. It simply is, because that is how it has always been done, and deviation carries risk. Even the placebo effect, one of the most well-documented phenomena in modern medicine, runs on the same ancient logic. A pill with no active ingredient can still reduce pain simply because the patient believes in the process. Belief in the procedure, trust in the person performing it. That is the exact mechanism that made a Stone Age ritual feel like healing thousands of years before anyone understood why. We like to think we left superstition behind when we discovered science, but maybe that's not quite right. Maybe science didn't replace ritual. Maybe science is what happens when a ritual gets tested enough times that it earns the right to be believed. Go back to that man on the ground 10,000 years ago with a hole cut into his skull. He didn't know what a neuron was. He didn't know what infection meant. But somebody, watching closely, generation after generation, had learned enough to give him a real chance at survival. He lived because of a ritual his ancestors trusted with their lives, long before they had a word for medicine. A ritual built not on certainty, but on generations of watching, failing, and trying again until something finally worked. That is the part we tend to forget. Medicine did not arrive fully formed, handed down by a genius in a lab coat. It was built slowly, painfully, by people who had no theory at all, only the will to keep their community alive one more season, one more winter, one more wound. The next time you sit in a waiting room, watching a nurse follow the exact same steps she follows for every patient, remember where that precision came from. It didn't start in a laboratory. It started around a fire, with a sharpened stone and a belief that if you did things exactly right, a person could live. That belief never left us. We just call it something else now.